My name is Dr. Mikhail Berman. I'm a founder and medical director of Testosterone Replacement program called Low-T-Doc. Today I'll be talking to you about how to properly fill the syringes. However, before you do anything with syringes and needle, I need to remind you that you need to wash your hands thoroughly with the soap and water. Now let's talk about syringes. Syringes can be of two different kinds. Lower lock, that you twist needle in, and lower slip, that you slip the needle and just tighten it. Each syringe is graduated. We in our program use 1 milliliter syringes, 1 ml syringes. And when you look at the syringes that will come with your package, you will see that each syringe is graduated like a tape measure. So first of all, syringe, when it's fully filled, contains 1 milliliter or 1 ml of solution, if it's fully loaded. Now you can see that graduation where this 1 ml is divided by 10 equal parts designated by numbers 0.1, 0.2, 0.3 and so forth. And of course this 0.1, 0.2, 0.3 is 1/10 of the syringe, of the milliliter. So this is how you can control how many tenths of a milliliter you actually filling in. Each tenth of a milliliter is divided by 2 parts, so it designates a half of a tenth, which is 0.05. So pretty much accurately you can go by increments of 1/20th of a milliliter. You need to get a clean towel where you want to perform the filling of the syringes, and place on this towel the 2 needles that you receive with the syringes. One needle will be 18 gauge needle, which is thick, and 25 gauge needle, which is thin. We use 18 gauge syringe to pull testosterone inside the syringe, and we use 25 gauge needle to actually perform an injection. So here I have a bottle with oil. Testosterone is an oil solution because it's oily substance, and it can be covered with some kind of a cover like that, or maybe some other cover, but it doesn't matter. You know that it will be covered. And also, when you uncover the testosterone or any other bottle for injections, you will see a little round area where you should stick the needle when you're filling the syringe. You have your syringe and you have an alcohol swab. First of all, what we do, we open the alcohol swab. What I do, I keep my fingers very, very close to the edge, and when I rip it, I don't rip the toilet, it just exposes itself. I take it and I thoroughly wipe the stopper of the syringe with alcohol to clean it. You need to do it with every filling of the syringe. Every time you actually put the needle to it, you need to wipe it with alcohol. Then I open the syringe. It peels apart at top, but I don't completely open it in 2 parts. I just open it enough to be able to easily manipulate syringe. so I don't touch the part that touches the needle. And then I open, the same way it peels at top, I open the 18 gauge big needle. And I also don't fully pull it apart because that allows me to keep the needle without touching the part that connects to the syringe. So I don't touch anything that is exposed to testosterone. Then I remove the syringe from the cover and I twist or slip, in case of a lower slip, the big needle into the syringe. Now I remove the cap and I insert the needle in this little round spot on a stopper. Make sure that the bell of the needle actually is immersed in the solution. And then, using slight pressure, you slowly pull the testosterone into the syringe. I usually do it slowly and I wait till the bubble will be at the top of the syringe. And I pull more than necessary for me to inject. And then I just express this back into the bottle until the measured dose is achieved. In this case, 0.6 milliliter. I withdraw the needle. I cap the needle carefully, it's sharp. And I dispose of the needle. And I put syringe back into the cover. As you see, I'm not touching anything inside there, so inside it's still sterile. After that, I open a needle for injection. It peels on top here. And again, I do not touch the top of the needle. I just expose it and holding the cover part. I take syringe from the cover. I twist the needle back. My syringe is ready to be used for injections and filled.